Good evening, everyone, and welcome to this quick 3-minute learning videos with Dr. Murali Bharadwaz for the NEET PG preparation. Today, I'm going to make you the experts in esophageal carcinoma. So, what is the most important clue? The word progressive, from solids to liquids. That is the most important clue to the diagnosis of esophageal cancer. Then examiner commonly gives certain clues in the clinical vignette. Age 50 or older, dysphagia first for the solids, followed later. That is, it is progressing. So later to dysphagia for liquids, first to solids. So this word progressive is very important that you need to look for. Any prolonged alcohol or tobacco use and 5 to 10 years of gastroesophageal reflux is a very common part of the story. Now, how do you diagnose, doctor? Endoscopy is indispensable because if you do endoscopy, you can do biopsy. Maybe the barium is the best initial test, but based on the shadows, you can't make diagnosis, right? Unless histologically it is proven. That's the reason endoscopy is indispensable, where you can do an endoscopic biopsy for the esophageal cancer. CT and MRI, not enough. Only to know the spread into the surrounding tissues, you do that. PET scan, mainly to look for the metastasis. You do that. And always the rule, if you are thinking cancer, no radiological test is most accurate. Only pathologist is the Supreme Court. Only he can be able to give the diagnosis. So how do you treat? Unless you resect, you cannot cure. And because it is the gut, GIT, surgical resection is always the thing that you should try. You can add chemotherapy, radiation to the surgical removal. And you can do a stent placement wherever you can't resect surgically, but you need to keep the path of the gut. So to improve the dysphagia, for palliation, for that only you use the stent placement. So to get the conviction, let's look endoscopically in the distal esophagus, how the esophageal carcinoma looks like. This is another classical very friable mass-like lesion of esophageal carcinoma. So let us quickly summarize how do you approach for the tomorrow's NEET PG exam and for USMLE. Symptoms are saying that maybe it is esophageal cancer. Get an upper endoscopy. If the study results are normal, you need to follow up. And if the suspicious lesion is present, perform biopsy. And if there is no evidence of malignancy, just do follow-up. But if there is any adenocarcinoma or squamous cell carcinoma, you need to do the PET, CT, etc., etc. If it is an adeno or squamous, the PET will help you to know whether there is any distant metastasis or not. If there are distant metastasis, you need to think about palliative therapy with brachytherapy or stenting. If there are no distant metastasis, you do endoscopic ultrasound, and that will let you know whether there is any lymphovascular invasion or not. If there is lymphovascular invasion, then you need to do the FNAC during endoscopic ultrasonography. No lymphovascular invasion, then you look whether the lesion is less than 2 centimeters or more than 2 centimeters. If it is less than 2 centimeters, limited to mucosa or to the lamina propria, you call it as T1S or T1A, and then endoscopic mucosal resection is done. But if the lesion is more than 2 centimeters, if the submucosa is involved, you then call it as T1B, T2, T3. Then you need to look for the other therapeutic options That is all the story of esophageal carcinoma for the tomorrow's NEET PG exam.